This episode is brought to you by Indeed. Stop waiting around for the perfect candidate. Instead, use Indeed sponsored jobs to find the right people with the right skills fast. It's a simple way to make sure your listing is the first candidates see. According to Indeed data, sponsored jobs have 4 times more applicants than non-sponsored jobs. So go build your dream team today with Indeed. Get a $75 sponsored job credit at Indeed.com/podcast. Terms and conditions apply.
Hey everyone, Chris here from MedPrep2Go, and I wanted to ask you to please follow us on social. There may be links in the show notes, or you can find us at MedPrep2Go on Facebook, Instagram, LinkedIn, and now YouTube. We'd greatly appreciate it as we try to spread the word about MedPrep2Go and keep medical education accessible and affordable. Do you need a break from studying? Check out the Dr. Raj podcast, where he discusses topics such as wine with Jesse Katz, sarcoidosis with Bob Saget, saving the bees with Sydney S. Sill, and so much more. The podcast also features guest host Becca Spar, who focuses on leadership and connection, as well as Dr. Michelle Kulai in her Everyday Rooms segment, where she talks to patients to share their stories and the challenges that come with different conditions. Just search for the Dr. Raj podcast wherever you're listening now and tune in for a variety of great guests and topics. Hey everyone, Chris here from MedPrep2Go, and welcome to our USMLE Step 1 Questions podcast. I'll be your reader for today, and in this episode, I'll be reading 3 physiology questions from our online qbank. As always, you can read these questions and more at medprep2go.com. And with that being said, let's get started with question 1, Physiology 7. A 30-year-old woman presents to the emergency department with severe abdominal pain and vaginal bleeding for the past 6 hours. She reports a history of irregular menstrual cycles. She has been sexually active without using contraception and reports a positive home pregnancy test 2 weeks ago. Past medical history is otherwise unremarkable and she does not take any medications. Vital signs are temperature 38.6 degrees Fahrenheit, 37 degrees Celsius, blood pressure of 92/58, pulse 128 beats per minute, and respirations 22 per minute. On physical examination, she appears pale and diaphoretic. Abdominal examination reveals tenderness in the right lower quadrant with rebound tenderness. A pelvic examination is deferred due to the patient's discomfort. Transvaginal ultrasound demonstrates an empty uterus and fluid in the cul-de-sac. Which of the following was the most likely site of implantation of the blastocyst in this patient? Is it A, the cervix, B, endometrium, C, fallopian tube, D, the fimbriae, or E, the ovary? And the correct answer is C, the fallopian tube. Implantation of the blastocyst typically occurs in the endometrium of the uterus. However, in cases of ectopic pregnancy, implantation occurs in an abnormal location, most commonly within the fallopian tube. This can result in abdominal pain, vaginal bleeding, and signs of hemodynamic instability. Answer choice A, the cervix, is incorrect. Implantation does not typically occur in the cervix. It primarily serves as a passage for sperm to enter the uterus. Answer choice C, endometrium, is incorrect. The endometrium is the normal site of blastocyst implantation in the uterus during a normal pregnancy. Answer choice D, the fimbriae, are incorrect. The fimbriae are finger-like projections at the ends of the fallopian tubes closest to the ovaries. They catch and sweep eggs into the fallopian tubes. Answer choice E, ovary, is incorrect. Implantation does not typically occur in the ovary. Ovulation occurs in the ovary. Fertilization usually occurs in the fallopian tube, and implantation most commonly occurs in the uterus. Key learning point. The blastocyst implants into the endometrium during a normal pregnancy. If implantation occurs in an abnormal location, for example the fallopian tube, it is termed an ectopic pregnancy. Question 2, Physiology 8. A 28-year-old woman visits her gynecologist for a routine checkup. She reports that she and her partner have been trying to conceive for the past 6 months without success. She has regular menstrual cycles with a duration of 30 days. She denies any history of pelvic pain or abnormal bleeding. Past medical history is unremarkable. She takes a prenatal vitamin daily. Vital signs are within normal limits. Pelvic examination is unremarkable, and transvaginal ultrasound shows no abnormalities. In a normal pregnancy, during which phase of the menstrual cycle does the blastocyst typically implant? A. Follicular phase. B. Luteal phase. C. Menstruation. D. Ovulation. Or E. Proliferative phase. And the correct answer is B. The luteal phase. In a normal menstrual cycle, the blastocyst typically implants into the endometrium during the luteal phase. This phase follows ovulation and is characterized by increased progesterone levels, which support the endometrium for potential implantation and pregnancy. Answer choice A, follicular phase, is incorrect. The follicular phase precedes ovulation and is characterized by follicle growth in the ovary in response to follicle-stimulating hormone, FSH. Answer choice C, menstruation, is incorrect. Menstruation occurs during the early part of the menstrual cycle when the endometrium sheds if fertilization and implantation do not occur. Answer choice D, ovulation, is incorrect. Ovulation marks the release of the mature egg from the ovary, typically occurring midway through the menstrual cycle. Answer choice E, proliferative phase, is incorrect. The proliferative phase follows menstruation and is characterized by endometrial growth and thickening in response to estrogen. Key learning point. In a normal menstrual cycle, the blastocyst typically implants into the endometrium during the luteal phase, which follows ovulation and is characterized by increased progesterone levels.
LifeLock, how can I help?
The IRS said I filed my return,
But I haven't.
1 in 4 tax-paying Americans has paid the price of identity fraud.
What do I do?
My refund, though.
I'm freaking out.
Don't worry, I can fix this.
LifeLock fixes identity theft guaranteed and gets your money back with up to $3 million in coverage.
I'm so relieved.
No problem. I'll be with you every step of the way.
1 in 4 was a fraud-paying American. Not anymore. Save up to 40% your first year. Visit LifeLock.com/podcast. Terms apply.
Hey everyone, Chris here from MedPrep2Go, and I'm asking for your help. We are currently running a survey to better understand you, our audience. We're looking for feedback on the podcast, our qbank, and to see what kind of content you would be interested in so we know how to best direct our efforts. The survey will be open until March 31st. We recognize that your time is valuable, so as a token of our appreciation, we're giving away 2 annual subscriptions to the podcast of your choice for winning participants. Just enter your email at the end of the form, and winners will be contacted in early April. Please take a few moments to help us out and complete the survey at medprep2go.com/survey. Thank you in advance. Question 3, Physiology 9. A 7-year-old boy presents with his mother to the emergency department for evaluation of a burn which he sustained 25 minutes ago after spilling hot soup onto his arm. Past medical history is non-contributory and he takes no medications. Vital signs are within normal limits and physical examination reveals a teary child with an irregular 3-inch patch of red skin on the right forearm that is starting to blister. Which of the following types of sensory nerves mediate the ability to sense the temperature of the soup? Is it A, free nerve endings, B, Meissner corpuscles, C, Merkel discs, D, Pacinian corpuscles, or E, Ruffian corpuscles? And the correct answer is A, free nerve endings. Free nerve endings are responsible for sensation of pain and temperature. They are present in all tissues except cartilage and the lenses of the eyes. They are broken into 2 groups, A, delta fibers, fast and myelinated, and C fibers, slow and unmyelinated. Answer choice B, Meissner corpuscles, is incorrect. Meissner corpuscles are large myelinated nerves responsible for the sensations of dynamic, fine touch, low-frequency vibration, and skin indentation. They are most numerous in hairless skin. Answer choice C, Merkel discs, is incorrect. Merkel discs are large myelinated nerves responsible for the sensations of pressure and deep static touch. They are most numerous in the fingertips. Answer choice D, Pacinian corpuscles, is incorrect. Pacinian corpuscles are large myelinated nerves responsible for the sensations of pressure and high-frequency vibration. They are found in deep skin layers, ligaments, and joints. Answer choice E, ruffian corpuscles, is incorrect. Ruffian corpuscles are large myelinated nerves responsible for the sensation of stretch. They are most numerous in the fingertips and joints. Key learning point. Specialized nerves mediate different sensations, though some may have overlapping roles. Free nerve endings primarily sense pain and temperature. Mesner corpuscles sense fine touch. Merkel discs sense deep touch. Pacinian corpuscles sense pressure, and ruffian corpuscles sense stretch. And that will conclude this episode of our USMLE Step 1 Questions podcast. I hope you enjoyed it and found the information useful. Please be sure to follow us at MedPrep2Go on LinkedIn, Facebook, Instagram, and YouTube to stay up to date with our content. You can learn more and read other Step 1 questions at medprep2go.com. Happy studying! Hi everyone, Chris here from MedPrep2Go, and our friends at Panacea Financial have a scholarship opportunity for $1,000 for underrepresented residents and fellows. Applications are only open until March 20th, so submit yours today. Apply and learn more at panaceafinancial.com.